Preeclampsia and eclampsia are two categories of pregnancy-induced hypertension. The HELP syndrome is a severe sequel of pregnancy-induced hypertension. Then the classification includes preeclampsia, severe preeclampsia, or eclampsia. Now, the risk factors for pregnancy-induced hypertension are primigravida, grand multigravidate, then essential hypertension, family history of hypertension, diagnosis of PIH in previous pregnancies, low socioeconomic status, diabetes mellitus, obesity, malnutrition, or underweight. Then the factors which develop during pregnancy and increase the risk of developing PIH could be diabetes mellitus, multiple gestation, gestational trophoblastic disease, GTD, or hydramnios or renal infection. Then severe preeclampsia, hypertension is mostly 140/90, and edema can be pitting type of edema can be seen. While in severe preeclampsia, blood pressure is 160/110, and proteinuria can be seen, or oliguria can be seen, hyperreflexia, visual disturbances, headache, pulmonary edema, sinuses, or epigastric pain can be seen. While in eclampsia, there is the presence of the seizures along with the raised blood pressure. And in HELP syndrome, which is a sequel of PIH, it involves hemolysis, elevated liver enzymes, and the low platelets. Investigations carried out in pregnancy-induced hypertension is the monitoring of urine, 24-hour urine, C for proteinuria, then kidney function, then liver function, bilirubin and enzymes, then blood picture or hematocrit, and coagulation profile, fundus examination, and CT scan is done to detect any cerebral hemorrhage, or ultrasound is carried out to find out if there is any IUGR or IUFD reported or not. Treatment is expectant treatment, in which the rest, diet with increased protein and carbohydrate and low salt, or sedation is suggested, and the investigations like BP, pulse, respiration, proteinuria is carried out timely. Then the control hypertension, prevention and control convulsion, then treatment of eclampsia, and at last the termination of pregnancy can be done. So prevention and control of the convulsion is done by the MgSO4. It is a drug of choice. It causes CNS depression. It can be given IV or IM. And general and first aid measures taken are isolation of the patient. Then the airway oxygen source suction apparatus should be present by the bedside. Then put the patient in Trendelenburg position. Insert a catheter and observe for the vital signs, level of consciousness, urine output, or the number of convulsions.